Should I get Dysport? That is a question a lot of my patients ask, and I am Dr. Lynn Nieman. I am a board-certified anesthesiologist and owner of Blossom Medical in Winchester, Virginia, and I feel like I have some expertise to give you a little bit of information about Dysport and to talk with you about whether or not it might be a good product for you. In our world, we hear a lot about Botox. It's one of those things, almost like Kleenex. I think that we use that word and we refer to a lot of different things. For your information, Dysport is a different type of what we would call a neurotoxin, and it does the same job that Botox does, just in a slightly unique way. And so I wanted to give you some information and let you know my experience with it, and you can make a decision whether or not it is right for you. So just a little bit of a history lesson, not to bore you, but just to let you know that Botox was it was basically the first of its kind of medication brought to market. And there's a long history that goes behind it, but I will just say that the two doctors who brought Botox to the market are a husband and wife team, Doctors Carruthers, and they were the first to use Botox around the eyes to treat a little spasm around the eye. And that little spasm around the eye for their patients got better. And as the Carruthers were doing their experiments, they also noticed that their patients were really enjoying some of the aesthetic benefits that they were getting when they were having these eye spasms treated. And they started their studies to look at the way that we can use this medication in an aesthetic capacity, and it came on the market strong. Allergan is the company that makes Botox, and I love that medicine because it is reliable and it gives very consistent results. But there are other types of botulinum toxins, type A, that we can use in clinical practice. So our botulinum toxins are medications that basically what they do is they reduce a signal that a muscle cell or nerve cell gives to a muscle cell to contract. So in that reduction of the signal from the nerve to the muscle cell, that causes a kind of chain reaction. So now our muscles can't pull on the skin quite so much. And if they can't pull on the skin quite so much, they don't cause the same wrinkling that we see on the surface of the skin when we make expressions or even at rest. So that's how the basics of that whole treatment of either Botox or those other medications. Botox is a medication that is called onabotulinum toxin A, and that's important. There are a couple different serotypes of botulinum toxin, but those are all botulinum toxin A. And our abobotulinum toxin A is a medicine that's called Dysport. So same base, just a slightly different amount of proteins that are carried with the medication. So now we're talking about molecular differences between the two neurotoxins that are in the medication that do the same job. They quiet the message from the nerve cell to the muscle cell to reduce the contraction to the skin so that we can treat things like treat our crow's feet, treat our forehead, treat our frown lines, maybe treat our bunny lines on our neck, or treat some of the smile lines that we have, treat some of our frowning muscles in our lower face, treat some of our platysmal bands. So both of those medications do the same thing. We're getting back to the idea. What do? They quiet down the signal from the nerve to the muscle so it doesn't pull on the skin quite so much. That's our whole treatment. If you are wondering whether Dysport might be the right thing for you, Dysport is a medication that is also, like Botox, highly reliable, and it is very clinically effective. My patients absolutely love it. So what are some of the other differences between Botox and Dysport? Why would I choose one versus the other? Some of it really boils down to preference. Some people are just going to like the way that Botox feels or gives them maybe look or appearance, or the way that they subjectively feel with that medication in place. Some people are going to prefer that. Other people are just going to prefer the way that Botox or that Dysport feels. So why might they feel different? Here's what I think about why they might feel different. Botox as a molecule is a tiny little bit bigger than Dysport is. So when we inject it, that Botox molecule tends to, based on the concentration that your injector uses when they reconstitute or add some fluid to a powder that it comes as, basically stays in a pretty small area because it's a bigger molecule, so it doesn't diffuse very far out. Because of that, Botox can just feel like a little bit stiff, or can feel a little bit like it's kind of maybe a little bit more frozen. Some people really like that approach. Dysport is a little bit smaller of a molecule. And so because it's a little bit smaller of a molecule, it tends to diffuse just a little bit more. So if you have a broad forehead or if you have a lot of crow's feet, so there's a lot of area where we want that kind of softness and that diffusion across a longer area, it really can treat those areas very, very beautifully. And that might be a reason why Dysport is a good choice for you. So again, in the foreheads, in the crow's feet, Dysport can be beautiful. Some people actually will use Botox in one area and Dysport in another area, depending on your own anatomy. That's also something that some providers will do. I personally prefer Dysport in my own face because I really like the softness that I get with my treatments and also the efficacy that I get. In your typical treatment, when you're on label with Botox, my patients clinically will get somewhere between 3 and 4 months duration out of their Botox. With Dysport, I find that most of my patients will reach closer to that 4-month mark with the clinical effectiveness of their treatment. In my practice, it's same per cost. Not in every office is it like that. And so it tends to be really just the same price, but you're getting a longer duration of action for your treatment. I find that Dysport, again, it's very reliable. It creates a beautiful treatment, and it can be used in all the places that Botox can be used. The difference tends to be in that molecular size, and so that kind of makes that treatment feel a little bit different. And always in some patients, they're just going to prefer, or they may prefer, one treatment to another. So with Dysport, you tend to get a little bit longer of a duration of action out of it, and so that might be something that's clinically relevant to you. Both of those companies, so the company called Galderma makes Dysport, a company called Allergan makes Botox, and both of those companies have some rewards programs. So as a patient and as a customer for those companies, you can get some rewards programs for both of those different neurotoxins. And let's face it, budget is a real thing. And so it's important to know that there are some ways to kind of offset some of your costs or look for ways that those companies are going to help to support you being a client for a long time or as long as you would prefer to have those treatments done. I think that they're both, again, really reliable. They're both wonderful products to use, and they can treat so many different areas that are life-changing for people just in terms of mood, in terms of treating surface lines and wrinkles, functionally treating things like bruxism or treating things like TMJ. There are so many things that we can treat with those medications, and we're learning so much more about them all the time. And so if you have any questions about Botox or Dysport, I'd absolutely love to answer those for you if you want to come in for a consultation. We are located in Winchester, Virginia. So Blossom Medical is in Winchester, Virginia, in Northern Virginia. And if you're not in our area, we do virtual consultations, but we'd also really be happy to answer some questions. And we have a network of folks that we can also kind of help you locate. So if you want any further information, we would love for you to like and subscribe below. We are doing this content for you so that you can feel educated and live as beautifully as possible. You all have amazing things that are just inside of you. And so if anything about your appearance, if anything about wrinkles, if anything about aging, if anything is just standing in the way of you going out and doing the most amazing things with your life, we would love to give you the tools and the answers to those things so that you feel like you can make educated choices and really just have the most amazing life. We are honored that you will allow us to be a part of your journey and look forward to seeing you next time.